Hello, my name is Vineetha Pagadala. I'm in 9th grade, and a little bit about me is that I study at Health Careers High School, and my research is about the neurobiological effects of opioids on pregnant women. This is a little overview about my research. I will be doing the introduction, the literature review, methodology and results, and the conclusion. Okay. The opioid crisis has affected many people in the United States, especially pregnant women. One of the main causes of the opioid crisis was overprescription in hospitals and pharmacies. These opioids caused pregnant women to suffer from opioid use disorder and eventually develop side effects from these drugs. Pregnant women had both psychological and physical effects, such as miscarriage from this drug. Not only were pregnant women affected, but their fetuses also suffered side effects such as neonatal abstinence syndrome. A few research questions that were in my research were, what leads to opioid overuse disorder in pregnant individuals? How are pregnant individuals affected? And what medications are safest to treat OUD? These research questions will be addressed in my presentation. My literature review. When I was conducting my research, there were many articles explaining how opioid use during pregnancy can lead to neurological side effects. Pregnant patients suffer psychological effects such as depression, anxiety, and PTSD, so they have an immense mental toll on their brains. The effects detailed were specifically from opioid receptors in the brain that cause physical effects in their body. Our bodies have opioid receptors that respond to stimuli. These opioid receptors control the body's response to hormones. One effect of opioid use is the raising of the HCG hormone. This hormone helps thicken a person's uterine line to support a growing embryo and tells the body to stop menstruation. So if the HCG hormone is actually affected by the opioid receptors, it can cause patients to can lead to patients to have a miscarriage. A few areas of weaknesses are how there are different results due to outside factors of the patient due to effects of pregnancy. So this basically means that not all pregnant patients handle pregnancy the same way. That also means that there's different factors that affect these patients in different ways. My methodology. This research was strictly a literature review. I took qualitative data and quantitative data to explain the different symptoms of pregnancy and opioid use, and I used quantitative data to explain how drastic these symptoms affect pregnant women. For instance, I measured the risk factor, how the different ratios of risks in NAS for different medications like methadone and buprenorphine. And this research was not an in-field study. I compared different articles about pregnant women, and I compared them and drew conclusions based on that. So this leads to my results. Opioids have a negative effect on the physical health and mental health of pregnant women. Newborns can also be affected by opioids when pregnant patients take opioids. The drug can travel through the bloodstream and get carried to the fetus. This leads to the fetus suffering a lower birth weight, SID, smaller and normal head size, unnormal head size, infections, heart defects, and birth defects. Lastly, when I was exploring these articles, I concluded that buprenorphine is recommended over methadone because methadone on the baby had a lot of more side effects, such as NAS, and this was just healthier for both the pregnant patient and the baby. Also, it isn't mentioned in my slides, but in the case of an overdose event, pregnant patients are recommended to take naloxone, which will reverse the effects of these opioids rapidly. Okay, my conclusion. My main research question was, what are the neurobiological effects of opioids on pregnant women? Opioids have greatly affected the psychological health and physical health of pregnant women. As mentioned before, pregnant women suffer the depression, anxiety, and PTSD. Opioid receptors in the brain are also affected by the drug and cause physical effects such as stillbirth. We can raise awareness about the impacts of these drugs on pregnant women by implementing programs and initiatives to raise awareness of these drugs used in the medical setting today. Thank you so much for listening to my presentation, and now I will talk about my experience with the Gifted Gabber program. I just really loved being a part of this program because the way that Dr. Kate and Professor Virgil guided me through this experience was very fulfilling and helpful. I knew that I could not have done this research without them. Dr. Kate was really helpful in explaining the different, how the diseases and how diseases were originated, and kind of like a little bit about, at the end of her presentation, she explained a little bit more about the opioid crisis and how opioids affect the community, especially in today's times. And also, Professor Virgil, she was very nice, and she's a good professor in explaining to me about the different APA formats, and she really helped me with the structure of my literature review, which I really enjoyed. And also, I'd like to thank Coach Joe and the Gifted Gabber program for presenting me with this opportunity to conduct this research and help make an impact on my community today. Thank you so much.
Wonderful, Vineetha. You can stop sharing. Okay, great job. And you did all of this when you were in grade 8, because I think she's the youngest student right here. She just started with grade 9, and it's pretty amazing your achievement is. So a big round of applause to Vineetha. Okay, Professor Kate, question for her.
Yes, excuse me. Congratulations on such a nice job. What physical risks are there to a developing fetus if the mother is taking opioids? Are we talking small brain size, lack of limb development? I know you said miscarriage or stillbirth. What else could happen?
Okay, yeah. So for the fetus, there's actually a lot of physical side effects. For instance, that the fetus can suffer SID, which is sudden infant death. And they also, as you mentioned, small brain size is one of them. And the small brain size can lead to lower birth weight. And also, in my research paper, I detailed a lot of long-term effects, such as learning disabilities and mental disabilities for the infant, or for the fetus. Yeah.
So these things carry on even after the baby is born.
Yes.
And that's quite sad. I think we need to, just as an aside, as a country, address the opioid problem, but we also really need to get women who are pregnant into treatment so that they can wean off those or get off of those opioids early enough in the pregnancy so that we don't have those really awful side effects. You did a great job. Thank you.
Thank you so much.
You're welcome.
Okay. Excellent. Thank you.